Good morning, everyone. Look at these faces coming in. Tune in Tuesday strikes again. We were so excited. Here, look at these faces.
So, before we kind of dive in throughout, if you have any questions, feel free to use the chat. I assume everyone is kind of understands how to use Zoom by this point, but if you don't, feel free to use the chat or unmute yourself and jump right in.
For those of you who want to turn your cameras on, we love seeing your faces, so feel free to do that. If you would prefer to have your cameras off, that's great too. We are about to start here. It's hard to believe, right? Another Tune In Tuesday. For those of you who are new, thank you so much for joining us today. Our goal is to lead you down the path of value adds in your organization and businesses in a way that's meaningful and goes beyond just getting a bill for your benefits plan or just going through the motions. And this is where we love to add value.
Absolutely. So with that being said, let's get rolling. It's 10 o'clock here. So our goal is typically around 30 minutes. We have so much content today from our guest, Andrea, that we'll introduce her in a moment. But so it may go a little bit long, but our goal is always to aim for around half an hour. So that being said, my name is Matt. This is Renee. We are on the benefits and group retirement team here at Wiegers Financial and Benefits. Our goal at Wiegers, our mantra, our mission statement is to make a difference in people's lives. So these webinars are one way that we do that, but here's some other ways for the planning for mental health, physical health, financial health, kind of you name it. Our goal is to be impactful in our clients' lives.
We always want to be your eyes and ears in the marketplace. And when we think about what that means, again, to business owners, plan sponsors, plan administrators, and how you are taking the role each day in being a custodian for your plan, these are the full realm that we can help you. Today, we are so excited to have someone who is going to completely revolutionize, identify gaps in your existing safety plan, and probably give you a whole lot of food for thought. Matt, please introduce our guest today.
So our guest today is Andrea Crittenden from 16 Safety Services. So Andrea, why don't you give us a quick, who are you and what do you do? Your little elevator pitch.
Awesome. Thank you very much for the welcome. As I mentioned, I'm Andrea Crittenden, the President, CEO, and co-owner of 16 Safety Services, Inc. in Saskatoon here. We are a occupational health and safety consulting and training company that assists employers with their duty to prevent incidents, create a healthy and safe workplace, and we love doing it with all of our being and all of our passions. So we provide solutions and services to go about your return on investment for your employees.
Perfect.
Love it. We know so many changes are afoot. April 1st, OH&S regulations. We know there's gaps in coverage in safety across the board for any sector here in Saskatchewan. Go ahead and take it away. We've got some screens to kind of help you, with your flow, but we want you to just tell us why employers today need to be looking closer at what their workforce is doing.
Absolutely. So, everybody knows that it's 2021 and governments are stepping up, big organizations are stepping up to raise the bar for health and safety. So there are so many aspects when it comes to health and safety and, how you create that safe workplace. There's so many, issues and challenges that employers face, whether it's your tasks or your specific scope of work, or whether it's your people or your program specifically, dealing, I guess exactly in construction specifically, there's a lot of areas where there's so many parts of the regulations where quite often employers become overwhelmed. Employers don't know where to start. They don't know where to, how to get that assistance, where to find out the questions and who can help. There are lots of organizations out there. I see there's a couple of members from the Safety Association, which is great. There's consultants and training agencies like ourselves that are out there. So for us, it's about helping those people and those employers comply with regulations for the true purpose of employees going home at the end of the day with all their fingers and toes to their loved ones, period. I do not want to be the person who has to knock on the door to explain why somebody is not coming home the same way that they left this morning, or not coming home at all. So a true purpose of mine is deep in my heart and soul when it comes to the work that I do. You know, looking at the chart, or the PowerPoint slide that you have open right now, Fit for Duty is becoming more and more in the forefront. There's more and more challenges that arise every day. The pandemic has not discriminated against anybody and caused an increased challenge in these situations. So when we're working with companies that have Fit for Duty policies, also known as drug and alcohol programs, I mean, there's more parts to that puzzle. But when we have, you know, clients that are required to have these policies and programs in place, required that their employees are in compliance with drug and alcohol testing results and programs, it becomes you know, a real challenge for employers to be able to comply. And there's so many aspects of Fit for Duty that encroach on HIPAA or health information privacy, jump into human rights, jump into labor standards, where employers really need to know how to do that, not only legally, but respectfully and professionally as well, to reduce or mitigate that risk to their workers, but also to their companies and their portfolios, which, you know, in turn, hopefully is reducing incidents out there in the workplace. So, you know, the safety professionals, employers, HR professionals as well, there's policies that should be in place if you have programs like that. Typically, these policies and programs are in place when people have safety sensitive positions. So that's where the health and safety of your workers is paramount. So there's hazards in the workplace that can and will affect these people should a use, misuse, or abuse of substances of any sort could affect their safety, but also the safety of others, as well as the health as well. So,
how do you then keep that employer accountable? Is there specific checklists or measures that organizations and employers can then use? Because you're right, it's an onerous task. A lot of times it's not going to be in the wheelhouse of most organizations that are running thin on staff already.
Well, especially, you know, written policies and procedures. I know that's, if you're used to being on the tools, then you all of a sudden at the end of the day, then you got, oh crap, now I need to put on my HR hat and now my OH&S hat and everything. It's kind of a minefield, like you said.
Yeah. What would you suggest?
So quite often, you know, clients out there are mandated by their hiring clients. So they stipulate you must meet this criteria. Your employees must be tested and in compliance with these drug and alcohol testing records. They specify the type of test. So really they lay it out quite clearly. But there are many resources available, and the Construction Owners Association of Alberta is basically the framework that most employers in Canada or most hiring clients in Canada base their requirements on. And I'm happy to provide all those links for you to forward. And then from there, they're able to build their policies to shape what it must look like. Okay. Now, just because you have a policy like this in place does not mean that, you know, you'd have to have a full-time safety person in place, does not mean that you have to have a full-time substance abuse professional in place. These services are all available in a contract or a consultant, you know, type relationship that's available out there for you to utilize as needed. So when it comes to the duty to accommodate with regards to fit for duty, it all stems back to with the employer's duty to ensure that they're providing that safe and healthy workplace. You'll have to pardon my little puppy in the background.
The fun from working from home, right?
Well, and the funny thing is I'm in the office today, so she's just too little to leave at home. So excuse my background noise, please. So like I was mentioning, every employer has that duty to provide a safe and healthy workplace. And there's a lot of content that, you know, goes into that very broad statement. And this is a huge part of it. So if an employer is required to have a policy like this in place, there are certain laws specifically to human rights, to labor standards, to Health Information Privacy Act, or HIPAA, which is a very, very strict, stern act that is heavily enforceable. There's major, you know, ramifications like you have on this slide here for not complying. So when it comes to the policies, it's important that you seek the right advice and the right people to assist you in building these policies and programs so that you're not overstepping the boundaries of those acts and regulations that are there. There are, you know, a lot more, you know, little tidbits that go in there that, you know, speak specifically to what you can and cannot do. And my one, you know, tidbit that I would make is that you recognize that anytime we're having medical clearance or results of health-related matters of any kind, that is a personal healthcare-related document or information for that person. So you as an employer are holding very confidential, very sensitive material that you must protect, and you must not forward on except where required by law. And even then, you definitely want to seek that legal advice in order to do so.
So I sort of have a follow-up question, because we deal with that a fair bit with disability claims in our area on employee benefits plans. And there's always a fine line between what your employer can know about your health and them trying to duty to accommodate, get you back working. So where do you see that gray area?
Good question.
Absolutely. No, that is a great question. It's as a safety professional, it becomes a little bit difficult to get a full-scale understanding of how you can accommodate. That's where it's important to have that relationship built with your employees on the trust as much as you possibly can, and you know, open up that dialogue to allow for discussions with doctors to the extent, again, of client or patient doctor confidentiality, healthcare privacy. So when it, you know, as far as like a workplace injury, let's talk specifically that way. There's information that you are privy to, and then there is information that you are not, regardless of what you prefer or think or want. So, you know, anytime you're dealing with an injury or even a situation where perhaps an employee needs to go on long-term or short-term disability for a situation that has arisen outside of work, you are not privy to the information with regards to the diagnosis. You're simply privy to what their restrictions are and how you are going to be able to accommodate those restrictions within your workplace. So it can become very challenging to to facilitate that accommodation if you don't have that the light duty or those accommodations available for work. Smaller employers or employers that specifically have heavy duty work as another example. It's hard to incorporate different factors with injuries or disabilities of any sort. So.
Recent media on Friday specifically, I think in a way does lead into the legal ramifications of not accommodating or when there is a worksite tragedy. And again, with the OH&S regulations changing April the 1st, what do you see in all of this? It's been a very turbocharged environment as it relates to safety in the workplace, again, on the heels of Friday's media.
Yes, absolutely. And I've printed off, and I have in front of me here, only 3 of the several situations, some of them that led to fatalities with regards to workplace incidents, leading to fines, convictions from OH&S. And the one thing to realize is, and I tell my clients and I tell people that I'm speaking with, when it comes to safety in the workplace, you cannot plead the fifth. It is your duty to know what you are required to facilitate, coordinate, do as an employer, as a supervisor. It is your duty to know. You can't say, I didn't know, I didn't realize. That's not an option. And what I also tell people is you are guilty until you're proven innocent, which is a flip-flop from what we normally believe from the law. So health and safety nowadays is becoming more to the forefront where it absolutely should be. I should not be reading about fatalities in the workplace or incidents in the workplace resulting in $935,000 in fines, leading to, $91,000 in fines, leading to $25,000 or $35,000 in fines, and the list goes on and on. Go ahead.
So beyond those fines, is there further ramifications for those businesses that were fined here? Like we're talking like a civil liability or that kind of thing?
Absolutely. And this is not typically where it ends, right? So when we're talking about, back to the fit for duty, if we're talking about a situation there where there's, an accommodation factor, we're talking about human rights looking for to come after you, labor standards potentially coming after you, as well as when we're talking about incidents in the workplace, you could be charged criminally under the Criminal Code of Canada for negligence and provide that safe and healthy workplace. And there has been several situations in Canada now where supervisors and employers have been charged under the criminal code and have actually been jailed, specific to gross negligence and an incident resulting in fatality in these situations. So it's here, it's not going anywhere, and every employer needs to understand that they have to have that in place, not only to protect their employers, their employees, because that's what's most important, but also to protect their own liabilities and their own companies that are out there that can open up huge risk and liability for themselves. So, working with the safety associations, working with safety consultants and trainers like myself is really important. And it's not mandatory to work with a consultant. There are ways to do it internally, and then ways to join in as needed with someone like myself on a piecework or basic contract type style. So it's
what do you typically call businesses and organizations call you in? Is it to help support the efforts of their internal safety people? Is it in the absence of having someone on site? When do you typically find that businesses reach out to you How do they find you, Andrea?
So we pride ourselves in being able to help full scale. So just to give you a sort of an idea of what our work looks like, there are several organizations where I'm the HSE or Health Safety Environment Manager under contract for these organizations that are out there. So I basically coordinate and look after everything for them on a contract basis. So it's not somebody who is on their payroll, not somebody who is, practically working every day, let's say, and having those overhead costs within your own companies. But then we look at the other ways that we can assist, and that could potentially be, there's companies that only want a safety inspection every 2 weeks on these work sites, ABC. There's some people that, they just want help to build their safety manual, or they want help to implement. They want help to become core certified. They want help to get all of their training completed. So there's so many ways that we can create that solution and assistance for you with as little or as much as you need. And we love every minute of it. It's something different every day. So it's fantastic to see the employers that are here wanting to listen in on the information that we're talking about today, and then be able to take away hopefully some good tips here.
Yeah, it sounds like you almost can't afford not to. I mean, it's interesting, a lot of parallels in what we do and what you do. I know we spend a lot of time trying to proact with our clients, making sure they're covering off their liabilities, making sure they're protecting their employees and protecting themselves in case something happens. Like our entire last Tuesday session was about employee benefits liability. And it is kind of a minefield out there. If you're not prepared and have it in writing beforehand, it's not a matter of if, it's a matter of when, unfortunately. And in the last few years, it seems to be more prevalent than it's ever been. I mean, with that, there was a really interesting statistic that I had read that's from an insurance company in Canada saying 75% of disability claims either have mental health as a primary or secondary diagnosis. And that's the old other side of this coin: psychological health, mental health. I mean, benefits plans can come to the front with employee and family assistance programs and that kind of stuff, but unless they're really used, they're not really going to provide that help that employees necessarily need.
Workplace safety, and Andrea, would you say is it a result that people's minds are so full and these rooms in your mind are just even more preoccupied than they once were? What are you finding?
Well, there's a lot of organizations that are really pushing psychological health and safety in the workplace, and they're highlighting the fact that if these negative effects of, like you say on here, workplace violence and harassment, potential PTSD issues stemming from a workplace incident, or even personal matters that happen separate from work, all of these aspects come to work with you and can affect the way that you are thinking. So in a safety professional's terms, mind on task is huge. I say that almost every day, where if your mind is not on your task and you're performing hazardous work, you can get yourself into a lot of hot water, and unfortunately it ends up in injury and worse, right? So WorkSafe Saskatchewan, again, the safety associations, training agencies, they're really pushing the psychological and health and safety, promotions and campaigns out there to, show people and employers what's available to them and how they can assist their employees. So, I mean, there's many ways that psychological health and safety in the workplace can be created, can be maintained. And what I've always told people is that if employees are mentally, physically, and emotionally healthy, then it's only going to create further productivity, further safety, further, awesome culture within your workplace. And, quite often people just don't know where to start. So, we talked about benefits programs and realizing and communicating with your employees that there's EFAP or Employee Family Assistance Programs, or just EAP, Employee Assistance Programs, where they're able to tap into those resources if they need, when they need, so that they can discuss these issues. And we can't forget that these issues can create further issues and bring into the workplace the substance abuse or misuse. And that in turn leads to further challenges and liabilities on the workplace as well. So if you're providing that information and that availability to your workers, it was a startling statistic that Renee and Matt gave in the last Tune In Tuesday, where it is incredibly underused. And, my question is why, right? So for all the people listening today, reach out to your benefits advisors and ask the question, can you come to our workplace and do a presentation? Can you hold these information sessions? Can you send out pamphlets? We need to get this information out there so that our workers feel as though and are aware of the fact that these resources are available to them for their use.
Yeah, that's such a great point. The average usage for some of these employee assistance programs is around 8%, which is so low. I have some cases or clients that, they've had something happen at work. And in those cases, seeing some of their usage reports is as high as 90%, which is amazing. I mean, these programs have become so important in the last few years that literally any new business that I approach and talk about benefits, I add an EAP assistance program on unless they tell me to take it out. The last few years, I've had so many workplace deaths, suicides, even just right now, everyone mentally is just done. Mm-hmm. They just need either someone to vent to, or just some tips and tricks for how to, to combat that presenteeism, like you said, to be active at work. I don't remember the specific term you said, but it was really good. It was like something with your body, like focused on the job. It was
Mind on
task. I love that.
I love it too.
Absolutely.
It's fascinating, Andrew, because I think what the resounding theme that we get from this is it goes beyond steel-toed boots. It goes beyond the drug and alcohol testing. And how do you, if you had takeaways that you could leave with our organizational leads and our business owners today to keep them out of litigation, to keep them out of the Canadian courts, what would those items be?
I would say, first and foremost is take care of your employees so that they can take care of your customers and your company as well. If you support your employees by providing that safe and healthy workplace, by providing the resources like an EFAP program and benefits, and the opportunity to seek that assistance, you'll find a much better result on and off the field, let's call it. That's only going to create more productivity, more, just a happier culture within. Now, when it comes to the psychological health and safety, especially with this pandemic that's happening, with unemployment, with slow work, with no work, with increasing mental illness severity levels, there's so many places where it does open up, and there are many ways that can help you to simplify what you're doing for a health and safety program to be able to provide that support. A safety program does not have to be this grandioso, complex program that nobody is ever going to pick up off the shelf. It should be tailored and built to your company specifically so that it makes sense to you. And my biggest thing is ask the questions. What do I need? And nobody is going to fault you for starting somewhere, taking baby steps to start with one program or policy at a time. Take those baby steps to implement it. If you throw a big, 500-page manual at somebody in the workforce who's never had a safety program in place, they're going to, they'll tell you exactly where to go. And it's all about that communication and that, explanation of how we are wanting to support you so that you can go home to your friends and family at the end of the day, right? So what I would say is baby steps, right? There's many ways that you can do that. And, specifically with due diligence, that is the biggest part. So asking the questions to see how, consultants like myself can help, what, those baby steps might look like is fantastic. That's the questions that you need to start with to be, proactive rather than reactive, dealing with the corpse, like you say.
Unbelievable. We knew our Tune In Tuesday of 30 minutes was going to fly by. It has. You are absolutely a wealth of knowledge. 16 Safety Services Inc. If you are not using Andrea Stark, she is going to give you far more of these nuggets of information to make your business thrive and grow. For those of you who are currently working with consultants on your benefits plans and group retirement plans, as Andrea mentioned, if these types of information is not coming to your core, it's worthwhile addressing or get us involved. For those of you who are new to us, please leave a Google review. The success of Tune In Tuesday relies completely on our viewers. We are so honored to have you join us today. Again, we wish you all the best in your daily work lives. And as you encounter each circumstance and decision in your workday, and they're all different, as Andrea highlighted, they are all so different. And every decision leads ultimately to growth in your industry. Finally, for those of you who it's been a quiet chat, and that's common when there's so much information. It's been fantastic. Andrea is going to be available to take questions from you. We're going to do follow-up with you as well as a replay, and she will be able to address any other additional questions you have relating to occupational health and safety regulation changes. That's a whole other realm, girl. And other areas of your plan. Matt, any final words?
Yeah, so we'll be following up with a survey. So please be honest, let us know your thoughts. We love doing these. And like I said, our goal here is always to make a difference in people's lives. And this is one way we're able to help out. So that being said, absolutely. I see there's no questions coming through. So look Andrea up, reach out to myself or Renee. But thank you very much, everyone, for attending, and join us for our next one on May the 4th.
May the 4th be with you. Have a wonderful rest of your day. Thank you, everyone.
Bye.
Bye-bye. Have a safe day, everybody.
Thanks, Andrea.
Thanks, Andrea.
Bye-bye.
Bye-bye.